Hello, I'm Kate Eyston, one of the Lymphedema Specialist nurses here at Willen Hospice.
And I'm Carly Polty, a Lymphedema Nurse Specialist here as well.
One of our recent initiatives and service developments that we've done within lymphedema is to, rather than see people once they've developed a swelling as a result of cancer treatment or the cancer itself, is to try and be more proactive and provide patient education earlier on. So for example, with a patient that's had a breast cancer and they've had some surgery, we will invite that patient into a group setting to have education about what lymphedema is and what the risks are for them. It's an opportunity for the patient to ask lots of questions about lymphedema, but as importantly to know about how to recognise when there is a swelling and how to access our service early on. So the educational session that we provide to this patient group is called BLES, which stands for Breast Lymphedema Education Session, and it's in a group environment, and we see sort of between 10 and 15 patients. If anybody that had any cancer or lymphatic surgery done that would want lymphedema education and want to be part of those sessions, then you can get your health professional to refer into Willen's lymphedema service.
So that could be your GP, your consultant, your oncology consultant, or actually any of your specialist nurses that you might be seeing after having your treatment.
So typical symptoms that somebody would experience if they had early signs of swelling would be a heaviness of the limb, achy, don't really know quite what to do with it, feeling like the skin is stretching, and if the jewellery all of a sudden is starting to be tighter and leaving indentations on the wrist with the watch, they're good indications that there might be some early signs of swelling, and actually that's when we want to see that person rather than letting it become a really significant problem which is harder to manage later on. So what we really want to do is raise awareness amongst healthcare professionals, but most importantly patients understanding the risks of swelling and recognising when there's a swelling, so we can receive an early referral, so we can provide treatment prompter and hopefully reduce the long-term effects of swelling that's been unmanaged previously. Anybody that's had cancer treatment that's affected the lymph nodes will be at risk of swelling, and what we want to do is provide awareness and recognition, patient recognition of any swelling, so we can get people gain early referrals.
Yeah.